Hello, my name is David Armstrong, and I'm a project director at the Center for Health Workforce Studies located at the University at Albany's School of Public Health. Now, today I want to talk to you about our New York Resident Exit Survey, and I intend to answer several questions about the survey, including such things as who do we survey, what do we ask, what does the survey tell us, how do we share information from the survey, and how does the survey inform health workforce planning? But first, I would like to provide you with some background on graduate medical education in New York. New York State trains the largest number of physicians in the nation. 13% of all the physicians in the US were trained in a New York GME program. Currently, there are more than 1,300 GME programs in New York and 18,000 residents in training. And we've been conducting this survey annually since 1998, with the exception of just a few years. So, who do we survey? The survey is completed by all residents and fellows who are completing a training program in New York, except for the following: preliminary year residents, transitional year residents, dental residents, and podiatric residents. All told, more than 5,000 residents and fellows are surveyed annually. Regarding how we administer the survey, well, we administer the survey with the help of our collaborators. And our collaborators are all of the teaching hospitals in New York State. We rely on their assistance to conduct this survey. Presently, I have 60 primary contacts located at hospitals in New York. And these contacts include GME directors and administrators, program directors for some of the smaller institutions, and designated institutional officials, amongst others. Our exit survey is a year-long process. In February, I reached out to all our primary contacts and asked them to update their program information. That is, how many graduates do they expect in a particular program? Do they have any new programs we should be aware of? Have any been eliminated? Then in April, we send information about the online survey to our primary contacts. We then finished collecting data in September, and in October, we began processing the data and prepared reports. So what do we ask? We collect information on a variety of topics, including demographic characteristics, medical education and training, education debt, upcoming practice characteristics, job market experiences, and expected starting income. And over time, since 1998, more than 60,000 residents out of almost 100,000 have completed the survey for an overall response rate of 61%. What does the survey tell us? Well, the exit survey allows us to monitor trends in GME and address important topics that may arise. For example, gender and racial ethnic diversity in GME. And as you can see by this chart, while gender diversity has increased over time, racial and ethnic diversity has not. We also monitor other trends in GME outcomes, including the in-state retention of residents and fellows after completing training, the relative job market demand of different physician specialties, and the gender pay gap in starting income of physicians. The exit survey can also address current issues. A series of questions related to the COVID-19 pandemic was added to the 2021 survey. The questions address the impact of COVID-19 on training and the job market for new physicians. How do we share information from the survey? Well, we produce several annual reports and research briefs. We also attend conferences and give presentations about our findings. These conferences include the AAMC's Health Workforce Research Conference and Academy Health's annual research meeting. And more recently, we've developed a New York GME data dashboard. The New York GME data dashboard website can be accessed by the general public and hospitals that participate in the survey. On the site, you can download reports and view data on a variety of topics by year and specialty. And if you're a member of a participating institution, you may log in to the site and view and download your institution's specific data. How does our survey impact health workforce planning? Well, the exit survey is a valuable tool for health workforce planning. The survey allows you to monitor important trends and address pressing issues. The information gathered from the survey can be used to make informed policy decisions on a variety of topics, including health workforce diversity and the impact of COVID-19 on health professions education. Now, for those of you who have more questions or are interested in developing your own survey, please email me at dparmstrong@albany.edu. I'm always happy to talk. Thanks for watching.